Ever wonder how ancient Eastern philosophy holds up under the harsh, microscopic lens of modern oncology? Well, you're in the right place. Today, we're diving into this explainer to demystify complex bone diseases. We're going to bridge two seemingly opposite worlds to uncover a unified and honestly totally fascinating view on human healing. Okay, here's our roadmap for today. We're looking at the TCM framework for bone diseases, modern medicine's 3 tiers, TCM's true clinical role, and finally, the underlying logic that connects the whole shebang.
All right, part 1. The TCM bone disease framework and its ancient unified logic.
So think about it like this. In traditional Chinese medicine, or TCM, there are no isolated random diseases. It just doesn't work that way. Whether you're dealing with a sprained ankle from a morning run or a complex tumor, the underlying mechanism is actually exactly the same. Your life energy, your qi, has deviated from its normal state. In this framework, literally every single medical event is strictly regulated by the delicate balance of yin and yang.
What's really incredible here is how every known bone condition fits seamlessly into just 6 distinct categories. It's like a giant puzzle. It ranges from external physical trauma causing sudden blood stagnation to the slow natural wear and tear of aging kidney essence, which, we call osteoarthritis. Then you've got congenital imbalances from birth, intense environmental factors invading the joints in Bai syndrome, severe toxic infections, and yes, even tumors. In TCM, tumors represent a total systemic loss of qi regulation. It's just a brilliantly comprehensive, unified way to categorize human suffering.
To really grasp this, let's zoom in and look at the extremes. An acute bone infection, that's described as yang evil erupting. It's hot, it's fast, and it's intensely destructive to the bone tissue. But a malignant tumor, that represents the absolute limit of yin-yang imbalance. The local qi regulation has completely collapsed, allowing abnormal growth to just go unchecked. And metastatic tumors go even further. They're actually viewed as a reflection of a total systemic bodily collapse projecting right into the skeleton. Moving on to part 2, modern medicine's 3 tiers, or the clinical reality check. So we've got this beautiful philosophical framework, right? But you might be wondering, how does modern evidence-based medicine quantify the treatability of these exact same diseases? Because where ancient medicine measures qi and energy balance, modern oncology and orthopedics demand cold, hard clinical metrics. And in that modern world, treatability isn't just about the name of the diagnosis. It essentially falls into 3 distinct tiers, based on tumor stage, patient age, and molecular typing. Tier 1 is your basic curable. Think prompt interventions that easily fix an acute infection or a benign cyst. Then we have Tier 2, which is hard but hopeful. These are things like early-stage bone cancers or chronic osteomyelitis. Now, these require grueling, prolonged treatments for sure, but they offer very real recovery paths. And finally, Tier 3 is hard to root out. This is where advanced, multi-drug-resistant cancers or severe osteoporosis have essentially depleted the body's natural healing capacity. To put a hard number on that second tier, just to give you some perspective, 50 to 70% of early to mid-stage osteosarcoma patients can now survive beyond 5 years using modern standard chemotherapy and surgery. And once you cross that critical 5-year mark, there is genuine, real hope for a complete cure. That is just a massive leap forward and a profound testament to modern targeted interventions. Now here is where these two seemingly different worlds actually perfectly align. Modern oncology's staging process, measuring tumor size, molecular type, and patient age, is essentially quantifying what TCM calls the self-repair margin. Think of it exactly like a smartphone battery. Both systems recognize that once the disease drains that battery past a certain critical threshold, the body's innate ability to fix itself is just gone. And at that point, the medical approach has to radically change. All right, Section 3, TCM's true role, evidence-based integration. So let's just cut right through the internet rumors here and look impartially at the evidence. The most important takeaway is this. TCM acts as a powerful adjuvant therapy to reduce toxicity and boost efficacy. It is absolutely not a standalone magical cure for bone cancer, okay? There is 0 large-scale clinical evidence proving TCM can independently cure malignant bone tumors. But, and this is a big but, acknowledging that fact doesn't diminish its value at all. Instead, it highlights its true, highly effective role as a supportive anchor during grueling modern medical treatments. Take a notoriously difficult condition like chronic osteomyelitis. Modern surgery often struggles here because Simply scraping away dead bone is incredibly painful, and honestly, it doesn't always stop the infection from coming back. But watch how this three-stage integrative approach unfolds. Early on, specific herbs are used to clear heat and toxins. Then, in the middle stage, modern surgical fixation is used to drain pus, while internal herbs are used simultaneously to support the body's strength. Finally, once the infection clears in the late stage, targeted formulas nourish the qi and blood to help the bone actually rebuild. It's this complete, start-to-finish supportive strategy. And when we look at bone cancer, like osteosarcoma, the integration gets even more precise. Specific herbal treatments aren't just based on old text anymore. We actually have national-level molecular pathway research proving that they actively protect the bone marrow's blood-making function during harsh chemotherapy. This is solid, observable science that synergizes with chemo, allowing patients to actually finish their life-saving modern treatments. It completely refutes those single-case internet myths about a magical cup of tea curing a tumor. Finally, Section 4, the underlying logic of the three stages, the grand synthesis. So when we place the ancient three methods of surgery right next to the modern three stages of bone injury, an identical philosophy just stares right back at us. Ancient texts spoke of clearing the bad, supporting the structure, and tonifying the body. Fast forward to today, and orthopedics uses the exact same rhythm. Clear the blood stasis, physically set the bone, and tonify, or rehabilitate the patient. The vocabulary might have evolved over thousands of years, but the fundamental biological logic of human healing, completely untouched. It maps out a perfect timeline of shared disease states. In the beginning, there's evil excess, whether that's physical trauma or an infection, so we absolutely must clear. Then in the middle, a critical standoff occurs between the body's strength and the disease, so we intervene to support or set the bone, stabilizing the battleground so the body's self-repair margin can actually take over. And finally, with the evil gone but the qi weak and the body exhausted, we tonify to rebuild that lost energy. I want you to think about this quote for a second. Modern internal fixation is an extension of the ancient support method under modern technological conditions. That brilliantly anchors the whole concept, doesn't it? Those advanced titanium rods, the precision plates, the surgical screws in today's operating rooms, they're literally just ancient wisdom applied with 21st century metallurgy. The goal has never changed: mechanically support the physical structure so the body's innate biological healing power, its qi, can do the rest. Ultimately, these two systems aren't opposing forces at all. They're two sides of the exact same coin. One provides a macroscopic framework of life energy, and the other delivers microscopic technological precision. So as we wrap up this explainer, I leave you with this question to ponder. When we strip away the dogma and finally unite these two powerful frameworks, what incredible, unimaginable healing breakthroughs are waiting just over the horizon for us? Thanks for exploring this intersection of knowledge with me today. Keep asking questions and keep learning.